It is Thursday. That means we have a vet here to answer your pet questions. So if you do have a problem with your pet, you can give us a call right now. The number is 460-KJRH. And as always, it's Dr. Joe Landers here to answer your questions. And he's brought along Maverick this morning. Good morning.
Good morning. How are you doing?
Good. Thanks for coming in.
Yeah, well, thank you. It's cold, but it's well worth it. Maverick here is a great little dog. I think I told everybody I wanted to call him like Ricky or Rocky the raccoon. We were trying to Google that before. I can't remember from highlights or something. But he's a good little dog. He's actually probably not all healer, but mostly he kind of came with a little bit of a tail, a little bit of kink.
He's got a pretty good coat to keep him warm,
He really does. This is a great little guy. He's very, very active, loves to run around. If you want a dog for your kids or something to run off a little energy, then he's kind of for you. He's over at Heritage. Someone just found him about 4 or 5 weeks ago, just running around. So he's been with us a little while. Very nice little dog. So.
And if you want to adopt Maverick, you can call Animal Aid at 744-8280 or log on to animalaid.org or call the number there on your screen for Heritage Veterinary Hospital. Let's get to the phones now. First up, we have Tammy. Good morning, Tammy.
Good morning, Dr. Joe.
Hi.
What's your question?
Yes, ma'am.
I just wanted to ask, my dog, it does not like to go outside in the snow to go potty.
Yep.
Is there anything at all I can do to help her?
No, most of the time I try to do something positive with our dogs. For instance, they like a little bit of cheese, so I'll take a little piece of cheese out there, and even though she doesn't really want to go out there, the cheese is kind of...
Got to get that cheese.
Definitely, you kind of dig down to some grass. A lot of dogs get confused. I mean, and it's just, you know, they call it substrate preference, and they don't want to go on it. You know, and if you can get down to some grass, usually that, but positive reinforcement, and understandably that they...
That's something a lot of people are dealing with.
Yeah, I don't like
now.
the cold either, so
can't blame them, huh?
Not at all.
Next up, we have Rihanna in Broken Arrow. Good morning.
Hi.
Hi.
What's your question?
Yes. I have a 9-year-old cat, and we just got a new puppy. And the cat seems to enjoy my puppy's water rather than its own water. And I was just making sure that was okay that they shared the same water bowl.
Not a problem. Not a problem at all.
And they have...
Yep, not a problem at all.
So.
And that's a good thing, because a lot of times when a 9-year-old cat sees a puppy, that's the last thing that it wants to see, because they're active and they're running around and they disturb the household. So that's actually a very good sign that at least they're kind of sharing that. You know, normally, you know, puppies can be very, very active, and so definitely give them both, you know, time away from each other if they need it as they acclimate. But no, that's fine to drink out of the same water bowl. That's fine. So. Okay,
let's stay on Broken Arrow and talk to Marvin. Good morning, Marvin.
Good morning.
Hi.
What's your question?
I've got a schnauzer. He's about 12 years old. About approximately 6 months ago, he started having seizures. Here about, it's been about 4 weeks now since he had his last ones, but he had like 3 inside of a 12-hour period. He's been fine since.
What I'll tell people is, as they get older, there's a lot of different things that can cause seizures, and that's something to talk to your veterinarian about. Usually we'll do some blood tests and especially check their liver and kidneys. If not, then it may be primarily what they call intracranial or up in their head a little bit. That sounds like quite a bit of seizures. Usually I'll start them on medicine when they're having one once a month, or if they have several in a row, or if it really debilitates them. You know, you want to try to get to the root cause. I wish that, you know, I tell people a lot of times, I wish I had a CT scanner, because that would really give us a lot of information. But definitely talk to your veterinarian. It sounds like it may be time for some medication just to make the dog more comfortable. So.
All right, we are out of time, but Dr. Landers is here every Thursday to answer your questions. If you missed any of today's segment, you can go to KJRH.com and click on the Lifestyle tab to watch it again. You can also learn about other pets who need homes and find out more about Heritage Veterinary Hospital. Thanks for coming in.
Well, thank you so much.
Aaron, back to you.